Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. MRI is one of the most advanced imaging technologies used in modern healthcare. Unlike X-rays and CT scans, MRI does not use ionizing radiation. Instead, it uses an incredibly powerful magnetic field together with radiofrequency energy to create remarkably detailed images of the inside of the human body. But how can a magnet create pictures? And why is MRI so good at imaging the brain, spine, joints, muscles, and other soft tissues? Today, we'll answer those questions by exploring the fascinating science behind magnetic resonance imaging. To understand MRI, we first need to understand magnetic fields. A magnetic field is an invisible force that surrounds magnets and certain electric currents. You experience magnetic fields every day. A refrigerator magnet sticks to your fridge because of its magnetic field. Even the Earth produces a magnetic field that allows a compass to point north. An MRI scanner creates a magnetic field that is much stronger than the Earth's. Clinical MRI systems commonly operate at field strengths of 1.5 Tesla or 3 Tesla, although other field strengths are also used in clinical practice and research. This powerful magnetic field is the foundation of every MRI examination. MRI focuses primarily on one element found throughout the human body: hydrogen. Hydrogen is abundant because much of the human body is made of water, and water contains hydrogen atoms. Hydrogen is also found in many other biological molecules. Under normal conditions, the tiny magnetic properties of hydrogen nuclei are randomly oriented. When a patient enters the MRI scanner, the powerful magnetic field causes many of these hydrogen nuclei to align with the field. This organized alignment is the first step toward creating an MRI image. Once the hydrogen nuclei are aligned, the MRI scanner briefly delivers carefully controlled radiofrequency, or RF, pulses. These radio waves provide energy that temporarily changes the orientation of some hydrogen nuclei. This process is called magnetic resonance. When the RF pulse stops, the hydrogen nuclei gradually return toward their original state. As they do, they release tiny amounts of radiofrequency energy. Although these signals are extremely small, they contain valuable information about the tissues from which they originated. MRI receivers detect these signals and send them to powerful computers for processing. The MRI computer analyzes millions of tiny signals collected from throughout the body. By using magnetic field gradients together with sophisticated mathematical reconstruction techniques, the system determines where each signal originated and converts the information into detailed cross-sectional images. Different tissues produce different signal characteristics, allowing MRI to distinguish between muscles, ligaments, cartilage, nerves, fat, fluid, and many organs with exceptional detail. This excellent soft tissue contrast is one of the reasons MRI is so valuable for imaging the brain, spinal cord, joints, muscles, and many internal organs. Unlike X-rays, which measure how much radiation passes through the body, MRI creates images based on the behavior of hydrogen nuclei within different tissues. One of the most common questions patients ask is, why is the MRI scanner so loud? The loud knocking, tapping, and buzzing sounds don't come from the main magnet itself. Instead, they come from components called gradient coils. During an MRI examination, these coils rapidly switch electrical currents on and off to slightly change the magnetic field in specific locations. These rapidly changing magnetic fields cause the coils to vibrate, producing the familiar knocking sounds heard during the scan. Because MRI examinations can be quite loud, patients are always provided with hearing protection, such as earplugs or headphones, to help make the experience more comfortable. MRI is considered a very safe imaging modality because it does not use ionizing radiation. However, the powerful magnetic field creates unique safety considerations. Before every MRI examination, patients complete a detailed screening process to identify any implants, medical devices, metal fragments, or other items that could be affected by the magnetic field. Some implants are MRI compatible, under specific conditions, while others may not be suitable for MRI. That's why careful screening is essential. Patients are also asked to remove items such as keys, watches, jewellery, hearing aids, credit cards and mobile phones before entering the MRI room. Medical imaging professionals carefully follow established MRI safety protocols to protect patients, visitors and staff. Some MRI examinations use a contrast agent to provide additional diagnostic information. MRI contrast agents differ from the iodine-based contrast commonly used for CT scans. When appropriate, MRI contrast can improve visualization of certain tissues, blood vessels, inflammation, tumours, or other abnormalities. Not every MRI examination requires contrast. Whether contrast is recommended depends on the patient's medical history and the specific clinical question being investigated. The decision is always made by the healthcare team based on the patient's individual needs. MRI technologists do much more than operate the scanner. They review patient histories, complete safety screening, explain the examination, position patients carefully, select imaging protocols, monitor image quality, and communicate with patients throughout the scan. Because MRI examinations are often longer than other imaging procedures, MRI technologists play an important role in helping patients remain comfortable and informed. They also work closely with radiologists and other healthcare professionals to ensure each examination provides the information needed for diagnosis and treatment planning. Strong technical knowledge, communication skills, and attention to detail are essential in this specialty. This is one of the biggest misconceptions about MRI. The truth is that MRI does not use ionizing radiation. Instead, it combines a powerful magnetic field with radiofrequency energy to generate detailed images. This makes MRI fundamentally different from X-ray and CT imaging, even though all three produce images used for medical diagnosis. Here's an interesting fact. Some research MRI systems operate at field strengths of 7 Tesla or higher, allowing scientists to study the human brain and other structures in extraordinary detail. MRI is also used in research techniques such as functional MRI or fMRI, which measures changes associated with blood flow in the brain to help researchers better understand brain activity. Let's review what we've learned. MRI uses a powerful magnetic field and radiofrequency energy, not ionizing radiation. Hydrogen nuclei align with the magnetic field, respond to radiofrequency pulses, and release tiny signals that computers convert into detailed images. MRI is especially valuable for imaging the brain, spinal cord, muscles, joints, and many internal organs. MRI technologists combine advanced technology, patient care, and strict safety practices to perform these examinations safely and effectively. MRI is one of the most remarkable technologies in modern medicine. By combining physics, engineering, computer science, and patient care, MRI allows healthcare professionals to see extraordinary detail inside the human body without using ionizing radiation. In our next episode of How Medical Imaging Works, we'll explore one of the most unique imaging technologies in healthcare by learning how radiopharmaceuticals help nuclear medicine technologists visualize how organs and tissues function. Thanks for watching In the Know Medical Imaging. If you found this video helpful, be sure to like, subscribe, and share this video to spread more in the know about medical imaging. What surprised you most about MRI? Let us know in the comments, and we'll see you in the next video.